Welcome to ConquerCam. My name is Janet Maker, and I'm the author of The Thinking Woman's Guide to Breast Cancer. I was diagnosed with stage 2 breast cancer in 2011, and I've been in remission ever since. During my treatment, I had several sources of support that were really important to me. So today I want to talk about the importance of support for cancer patients. When you have breast cancer, you need all the support you can get. Even if you have very supportive friends and family, unless they've had breast cancer, they really don't know what it feels like. When I was first diagnosed, I told a lot of people I had breast cancer, and I gave them permission to tell whoever they wanted. My thinking was that the more people they told, the fewer people I would have to tell. But I had an unexpected side effect, which is that lots of people had friends or friends of friends, and they all came out of the woodwork wanting to help because breast cancer is so common. So many people have had it. And I got a lot of information that way. Another thing I did was join a local breast cancer support group, and I also joined an online support group, which was international at breastcancer.org. And from all of those sources, I got a tremendous amount of information. I got all of my doctors, including my integrative oncologist, and I didn't even know about integrative oncology before that. I saved my hair during chemotherapy, even though the chemical I had a 100% chance of hair loss. I reduced my side effects during chemo by a fasting program. I avoided mouth sores, neuropathy, and many other things, all because of the help I got from other patients. In addition to the information, the support, the emotional support that I got was just as important, because when you have cancer, you feel frightened and isolated, and a feeling of solidarity and help from other people is just invaluable. Thanks for watching. I hope you'll consider sharing your story with ConquerCam.
I think the biggest thing is find the trusted sources of information. I can't emphasize that enough, whether you're talking about immune therapy in general or your particular cancer type. And there are those trusted sources of information out there, the ones that are constructed by patient advocacy groups or by nursing navigator groups or by our own scientific groups. You know, everyone is actually actively interested in and working on developing these validated, understandable patient resources that are put together from a patient and family literacy perspective. There's no scientific mumbo jumbo to it. And they're out there. People are continuing to work on them. So when you're having that conversation with your oncologist or with your nurse navigator, ask them, if I was to go online to find information, where should I go? Have that be a directed search as opposed to just typing in lung cancer, because God knows you're going to get overwhelmed with information. So I think being able to ask about what are the resources that you use for patient education, and where should we be looking for info, or what if I wanted to talk to other patients about their experience, where should I go, who should I talk to, is an important part of that. And I think also being able to have that conversation with your team about, well, what's next? Because I think that's also the elephant in the room oftentimes when we're taking care of people. You know, we all hope, of course, that first choice of treatment is going to knock it out of the park and the patient's going to do great. And certainly we aim for that. We swing for the fences. But the sad truth is that there's still a big majority of patients that don't respond to that first treatment. And what's plan B and what's plan C? And maybe not ask it in in an interrogative way, but be able to ask the oncologist or the treating team, okay, well, do we have other options that exist beyond this one? Because that's, I think, what all of us are constantly grasping for too. So if I had to say two main questions that patients and their families should be thinking about, and what nurse navigators should be thinking about, because that is essentially what you're doing, you're navigating that patient on their journey, would be what are the resources that are going to be most informative and truthful? And then what's our plan if we don't get the response that we're hoping to see?
Hi, welcome to Conquer Can. My name is Joyce Beecher. I am the caretaker, and this lovely young gentleman is my husband, Richard Beecher. We're married now for 50 years. Rich was diagnosed 15 years ago with chronic lymphocemic leukemia, and was it detected every year religiously. We go for our yearly physicals. And 1 year, our primary doctor had noticed that Rich's white blood counts were elevated and compared to last year's reports. And he said, Mr. Beecher, it could be something, it could not be something, but I think it's time now to get checked out by an oncologist. So he recommended the finest oncologist in Freehold, New Jersey, which we went immediately. And of course, as everybody knows, getting a doctor's appointment is not immediately. But when you call up crying hysterical, my husband has cancer, he's going to die, you have to see him. I don't know how to work the television, I don't know how to work the VCR, I don't know how to work anything, you have to see him. Lo and behold, we did see him, and it was confirmed that Richie had CLL. And of course now, I looked up everything you want to know about cancer and leukemia on every cancer site. But as our oncologist said, you can't believe everything. Listen to your doctor. They know what it is all about and the cutting edge. So to make a very long story short, from the local oncologist, we could have stayed with him, but I don't know, it's just our mentality. We wanted the best of the best. So we went immediately to Sloan Kettering, and we got one of their leading experts on CLL, Dr. Mark Weiss. And Rich went for a full physical and said, you have the best cancer going. It's very slow moving, indolent. He called it an indolent cancer, that we're just going to watch it and watch it and watch it. So for 5 years, we were watching Richie's blood counts and everything was fine. And then, of course, on one visit, his counts became totally escalated. And the doctor then informed us it's now time for chemo treatment. And of course, we were hysterical, and everybody thinks cancer is the death word. Let me tell you, there are all types of cancers and all types of treatments, and we're now in 2018, doctors are on the cutting edge in these leading hospitals. And as a matter of fact, again, I'm fast forwarding, if Rich was diagnosed today, he would not have had chemotherapy. They now have these horse pills that they have now given to patients with CLL, and it's been remarkable. It's been remarkable. But Rich has had several, slides in the roads or bumps or waves that as long as he's away from anybody with a cold or a flu or viruses, because Rich has no immune system. So he started off with something called chemo light instead of aggressive heavy dosages for 6 months, and then the next 6 months was more elevated. So everything is now working smoothly, but he has to receive, he stopped the chemo because you only get a year of chemo. He's now on a maintenance treatment called IVIG. That's to maintain his wellness. And also after such a long dosage of chemo, he's on a regimen of Iridia. That's a calcium infusion. And again, everything is working well, but we've had a couple of setbacks where he's been hospitalized for pneumonia, And unfortunately, pneumonia affects people over 70 very, very severely. But he's doing great. He's doing great. And as far as being a caregiver, it's a lot of work. It's a lot of work managing yourself, managing your husband, being air traffic controller. But can I say one thing without crying? Never give up, never surrender, and be strong.
It's important to encourage patients to participate in clinical trials because that has a lot of benefits, starting with the patient and then also with the healthcare system and everyone else that would walk that patient journey afterwards. First of all, you're providing the patient with an opportunity and a hope to potentially extend life, live better, and obviously not every drug is delivering that to every patient. That's why we're talking about personalized medicine. So you have to really wait through your healthcare providers what would be the right approach. But if it happens, it would be a great opportunity for the patient to actually have the potential to live longer. The healthcare systems would also benefit from that because trials nowadays are underutilized, and we know the selection of the patients has been a major challenge, especially in oncology. If you think of oncology, it's very similar to orphan disease. In orphan disease, you have 5 or 10 patients across the globe that have a certain mutation. And it's such a challenge for a treating doctor to find someone else and see what they have done through trial and error. Here, you have a very unique pattern. You don't have that one mutation, but you have a pattern of 10 different mutations that exist in a certain combination out of 20,000 different genes in the body. So this doctor that's treating that patient needs to find another doctor somewhere across the country who has exactly the same problem and see how they have dealt. You need that support group. So that's the support system that you provide. And also data. As you do trial and error on the patient, you would then loop back and potentially change standard of care or become a standard of care for that type of disease. And we are in a good place, I believe, and not being in the regulatory space, I have to be careful how I express my opinion. But clinical trials in oncology have developed significantly compared to other clinical trials. They have generally shortened their duration. And second, they have decreased the number of patients that they enroll. We're not talking about hundreds or thousands of patients, but we are talking a very small N. And that's an opportunity.
Hello and welcome to ConquerCam. My name is Melissa Marshall, the president and the founder of the Know You Cancer Foundation. 4 years ago, I was diagnosed with rectal cancer, stage 3. I am currently in remission and cancer-free. Here is my cancer journey. As a singer, dancer, and songwriter, I was working every single day and suffering from a bad hip. I had also just turned 50. So I thought that some of the symptoms that I was seeing were more as my age. I was due to have a hip surgery, and I decided to go and have the rectal bleeding, which I had told nobody about, looked at. It was discovered very quickly that I had a tumor that was very large sitting on my sphincter, and instead of having hip surgery, I was going in and I was receiving cancer surgery and receiving an ileostomy that I now have for the rest of my life. Once I left the hospital, I had a vision which is now upon my neck. I also had written the song, Know You Cancer. When I start to write, I usually don't look at the lyrics. I look at them afterwards. And what I had discovered as I had written was that it sounded as if I was talking about a guy that did me wrong, but actually it was cancer. So the No You Can't, Sir song was born. As well, as many times as I was out and about, I would get compliments on my necklace constantly. I decided that I needed to replicate it, and we first started with 5 different colors. We are now, very happily, up to 8 different wonderful, beautiful colors of this necklace. As well, we have now encased it within the song, so it's available to you like that. So it's as if you're taking it right off of my neck. Next came the It's in the Bag Ostomy Awareness. As I began in my journey and continued, I discovered that I quickly became an advocate for those wearing an ostomy bag. I had never known that there were such negative myths and misconceptions surrounding this kind of cancer, and that those that received the ostomy bags didn't have such a loud voice, but I knew that I had a very loud voice. And so I became the person that was vocal enough to speak out and to try to help dispel the negative myths, misconceptions, bring awareness, and to educate those that are just coming into the world of becoming an ostomate, and their family and friends and the general public. That is how we have now started the publication of It's in the Bag Ostomy Awareness, and very, very happy to say we are in over 50 hospitals and doctors' offices around the country. I am continuing to try to be the strongest advocate and to know as much as I possibly can to help every person that is receiving an ostomy bag learn that they are not alone, that they can get through life, they can be active and healthy and enjoy their life, and to understand that this does not hold you back. I am so honored to have been distinguished with the Conquer Magazine AONN 2017 Hero of Hope Award. I never expected to have such an honor in such a short time. I am so happy to be here with you. I want to encourage you to make sure you get your colonoscopy, that you make sure that you know your family health, and I want you to make sure that you treat your body and you treasure your body as much as you possibly can. Make sure that you investigate all avenues and see all those that you want to see. I'd like to thank you for watching the Conquer Cam. I want you to be strong enough to say no you cancer and help conquer your cancer. Thank you.
FDA approval for CAR T-cell therapy really comes from robust clinical trial data. The FDA is really looking for, first, whether or not this is a safe therapy, and also, whether it's going to be effective for patients. In our experience at the Children's Hospital of Philadelphia, we had multiple CAR T-cell therapy trials open, one of which we presented to the FDA along with many other sites across the U.S. to really show that it is effective, and it also is a safe therapy for patients. It's really exciting to have the FDA kind of considering these new types of therapies and reviewing these types of therapies, but it is incredibly complex road to get there.